Today I'm going to be demonstrating 3 different special orthopedic tests. Piriformis test, also known as fair test, Kernig's sign or Lasegue's test, also known as straight leg raise, and Tinel's test at the ankle. Piriformis test, also known as fair test, fair standing for flexion, adduction, and internal rotation. The purpose of this assessment is to determine whether or not the patient has piriformis syndrome. A positive test result will be indicated by pain being felt by the patient in the lateral hip region of the affected leg. In this test, the patient is in side lying with the knee and hip both flexed to 90 degrees. The therapist stabilizes the hip and internally rotates and adducts the hip by applying a downward pressure to the knee. The therapist is paying attention to a response of pain by the patient. This would indicate a positive test result. Kernig's sign, or Lasegue's test, also known as straight leg raise, is done to assess for impingement of the dura and spinal cord or nerve roots of the lower lumbar spine, especially the sciatic nerve. For this test, the patient is in supine with their legs extended and their head in neutral. The examiner stands adjacent to the pelvis of the test leg and places one hand on the patient's knee and the other is used to grasp the patient's ankle and lift the leg into flexion. The examiner flexes the patient's hip until the patient complains of pain or tightness in the back or back of the leg, then slowly lowers the leg where there is no pain and passively dorsiflexes the foot. This test is done bilaterally. A positive test result is indicated by pain in the back region or in pain in the behind the legs. Tinel's sign at the ankle, also known as Tinel's test and Tinel's tarsal tunnel test. The purpose of this assessment is to determine whether or not the patient has tarsal tunnel syndrome, like that of the wrist, carpal tunnel syndrome. For this test, the patient is seated or in supine with the ankles in neutral. The therapist uses 2 fingers and briskly taps the posterior tibial nerve, which is just posterior to the medial malleolus. A positive test would be indicated by the patient experiencing pain or tingling down the ankle and into the foot along the root of the posterior tibial nerve.